explaining to the Public Investments Committee on the Auditor General's report on the destruction of an assortment of drugs worth 150 million shillings after their expiry date. Stanley Lugaria now reports.
The Drugs Distribution Authority, KEMSA, led by Chief Executive Officer Andrew Mulwa, on Tuesday, while appearing before the National Assembly Committee on Public Investments to answer on the reports arising in the Auditor General's report, Nancy Gadungu, on alleged misuse of funds from the authority's financial reports for the financial years 2017 to 2021, respectively. The committee wants the authority to explain the real situation in the process of dumping of expired medical products and how to eliminate criminals in the waste of the authority's money.
To indicate that despite the quality problems that this product had and was withdrawn and delisted, there was change in policy from the syrup to the dispersible tablet. So I think even if the product was to be even if the product was to be lifted, he could not supply that product because it was no longer in use for clinical management, and therefore there was a product substitution agreement.
KEMSA boss had a difficult time explaining the claims of misuse of authorities' money by the previous leadership, as he concurred with the Auditor General's report that KEMSA did not have the title deeds of land worth more than 150 million shillings, including title deeds of Meru municipal land.
So it was hard to establish the ownership. Is it owned by KEMSA or is it owned by the state agency? To resolve this, we approached the county government, and they gave us an alternative piece of land, about 10 acres, which we have progressed, and we now have a title deed.
But we have made a lot of progress in terms of the land getting title. Most of it is the cadastral survey, which has already been undertaken. We are awaiting the report.
According to Auditor General, KEMSA could not explain the claims of exchange that may have received as discovered in the report. Mulwa failed to provide a complete report on business and other payments, including long-term debts of more than 800 million shillings that could not be provided, while he failed to explain why the authority did business with the Ministry of Health on debt.
There was a question on why we are doing business with the Ministry of Health on credit. I've just explained that we offer supply chain services. We offer supply chain services to the ministry for the national strategic programs, and once we finish the distribution of the commodities under those programs, that is when we invoice the ministry. We don't give credit to suppliers. We don't, not unless, and it's very rare. It has happened about only 2 times in my 12-year experience, where a supplier is supposed to be given prepayment for a certain project.
Regarding the implementation of the budget, Mulwa found difficulty in explaining the lack of income of more than 452 million shillings, while the committee requested the authority to avoid the huge budget allocations so as to avoid funds misappropriation as captured by the Auditor General.
The wisdom of the administration then was to do that. The practice currently is different.
Misappropriation of public funds took center stage during the meeting today. KEMSA, while appearing before the Public Investment Committee, has concurred that indeed there was public misappropriation of public funds, and now has been asked by the committee to turn around the issues. Stanley Lugaria, Look Up TV, Nairobi.